This, so first of all, thank you for braving the cold and coming here. I hope it's a thought-provoking seminar for you, and you might walk away with a few tips that might get you thinking a little differently how you might consider your own dissemination and implementation research. The objectives I wanted to cover in my presentation are the following. To essentially share some frameworks or concepts and examples from healthcare as well as social marketing that might be applicable to many of the challenges we face in dissemination and implementation sciences. And I'll be talking to these 3 points in specific. Considerations for audience segmentation and targeting. Once you've identified the target audience, how you can think about positioning, and then what might be called the 4 Ps of the marketing mix. So it might help me so that I can tailor my talk most appropriately. How many of you have been exposed to these concepts before, either formally or informally? Okay, you have. So part of it is recognizing that some haven't heard it at all will be a good definition. But part of it is I'm trying to make the bridge between what is often discussed and what might be marketing for the private side, what might get translated as social marketing for what might be social good. And then how do we think about this in the context of implementation science? When we're often trying to get behavior changes such as additional screening or reduced unload screening or getting people to eat and exercise better or get vaccines. So I'm going to try and bring in examples there that make that translational bridge between some of the terminology that you might hear on the private side versus on what might be more the public sector side. So why marketing? Well, the NIH actual program announcement for dissemination implementation research actually specifies that we as implementation scientists should be looking at other disciplines, other fields for learning in terms of collaboration, utilizing theory, findings, and methods. And they call out one of the relevant fields is marketing. You may have also been introduced, many of you, to the concept of social marketing. This was largely put forward out of the Kellogg School of Management around how you take marketing principles and think about them in the context of social good. So in terms of social marketing, it's the activity or processes for understanding, creating, communicating, and delivering a unique and innovative offering, that's the product, if you will, to overcome societal problems. And so there are many examples that I'm sure you've all seen from the public health sector that really were social marketing campaigns. The CDC has one called Get Smart campaign, knowing what antibiotics work, trying to emphasize appropriate use of antibiotics, particularly for children. The Eat 5 a Day with fruits and vegetables has been a campaign that originated in the early 90s. Click It or Take It, it's all about trying to reduce injury prevention, and there's others here as well. So we see it in the public health realm. Now, how do we think about that in the context of implementation science within a healthcare setting? And that's where I'm going to go with the rest of the talk. Marketing has a cyclical approach that is thinking strategically and walking through these steps. You can really jump in at any point in the cycle, but for the sake of today's talk, I'm going to start in the top right-hand corner, in which you've done your formative research or your market research, and now you're starting to think about how do I design an implementation program or project. And really this lecture links with some of our earlier seminars. So if you remember, Karen Albright talked about qualitative methods and mixed methods. Another way of framing that in the market side would be that's your market research. Do you understand the needs, the barriers, the wants of your audience? And using that knowledge, you can then design what might be your best implementation strategy. So we'll talk with segmenting and targeting. Once you know who you want to target, and this is a little interesting because in public health or in healthcare, we think, it's not like a company making a choice that I just want to target this particular set of consumers. We have a public health mission that we need to try and help everybody, right? So if we're trying to create campaigns in order to improve physical activity, it's not like we are going to ignore the entire America, but what it says is that we might start out with certain segments where the need is greatest, and it might mean that by understanding that segment, we therefore design our communication segmentation strategy specifically in this segment. We'll talk a little bit about that. Once you know who you're targeting, thinking about the implementation strategy as a product that has a value, a benefit. And how do you think about taking what we tend to look at as just facts? Of course, you want to do screening because it reduces diabetes. Reducing diabetes improves cardiovascular risk. But how do you communicate that in a way that might be compelling for someone to change their behavior in his practice? And we'll be talking a little bit at how you think about the triangle of value that's often used in marketing. Think about the economic, the emotional benefits that you might be thinking about, not just the functional technical benefits. And then from there is what I could call the marketing mix or strategy that the four P's we talked about. And then you launch and evaluate. So if you remember back when we had Jim Deering speak, he talked about diffusion theory. Diffusion theory would often inform how you might think about the strategy of launching and some of your communication strategies and so forth. There's a whole realm around how you evaluate your marketing plan as well as the success of your marketing campaign, which we won't touch on today, and really overlaps with some of the work that's going on in implementation science around what are the best metrics that we should consider. But for today, I'm just focusing on segmentation, positioning, and marketing. Okay? So what is market segmentation? It essentially means that one size doesn't fit all. It's the process of defining and sub-defining a large heterogeneous market, or population, if you will, into clearly identifiable segments having similar needs, wants, or demand characteristics. We commonly do this in healthcare. When we think of this is a product, a drug that might be used by specialists such as cardiologists versus primary care. Inherently, we know that different barriers might be present in those two settings if you were trying to get that drug used or screening or what have you. We often segment based on age of patient, right? This might be considerations if this drug is used in children versus in adults versus in adults. What segmentation does is go beyond just your demographics, but it's starting to think about within those demographics concepts like readiness to change, where they're located, what are their values and attitudes, and drilling down a little further. Now, why do we do this? Well, companies do this in the private sector because you typically don't have resources to create products for every single consumer. It's akin to what we might have as a personalized medicine. Do we have the ability to create, infinite tailored products or medical options for everybody? Usually not. And so, therefore, companies will look at what are their competencies, what are their strengths, what's the competition doing in the market, and therefore be strategic around this is a group I'm going to try and focus on. Well, healthcare, we have limited resources as well. So if you imagine yourself as the director of medical services for a state Medicaid program. I work with one, and he's trying to improve diabetes screening for his state among patients with serious mental illness. He also has limited resources as to where can he focus his efforts. And so you can use these same guidance to say, where should I target which kind of intervention? And really the goal is so that you get the best marketing mix, the best intervention strategy, if you will, matched with that particular segment. In the consumer world, you might say that it's delightful. Right? You want to have products that delight you, such that you want to go and promote them to your friends. So if you think to yourself, what are products that you buy that you just find very exciting? Is it an iPad? Is it when you go to Starbucks? Is it a certain store that you might be going to, right? We're trying to create that same delight in healthcare, right? And that's a little challenging, but can we come up with a hook that makes people feel good about why they're wanting to adopt a certain treatment or not? And that can be providers as well as patients. So, variables used to segment markets. We've talked about some. So the geographic ones as well. Are we focusing, in many cases, we might focus geographically on just the state of Colorado. We might focus just geographically on the Denver metro area and providers. Or we might be thinking nationally. Usually, from what we do, we're thinking locally because we're adapting to the local environment, as opposed to thinking the national campaign. Demographic we talked. And it's important here, a lot of what we implement we tend to think it's patient-directed, but it really, in fact, the intermediary is often the health provider. So it's thinking of the consumer as the provider or the system, and therefore what are their demographic characteristics and what are their psychographic characteristics. You can all think of certain brands that are geared towards high socioeconomic, Starbucks coffee, W, certain chromosomes, etc. But there's socioeconomic status providers too, right? Large group practices versus solo might have different resources available in order to try out or purchase new ideas. Then there's behavioral ways to also segment the market. This might be desired benefits that you're hoping to get out of the product, or the implementation, or it might be barriers that you're facing to do that. It might be use occasion. So what's a use occasion? A use occasion is, let's say you're selling milk, for example. How you, a person coming into a convenience store at the gas station, how you might condition a gallon of milk there versus in a grocery store where it's at the back of the store because they're hoping that you're walking through the store in order to get your milk and you might pick up something on your way back out. Right? So that's different purchase location and use as well. So in a convenience store, another use might be I'm less likely to buy the gallon of milk maybe, and I'm more likely to buy skincare. So how do we think about use occasions in healthcare? It might be, is this in the emergency setting clinic? Is this in primary care? Is this in the hospital? And so thinking about what are we trying to get adopted in terms of the health behavior in this setting. And then attitudinal. So we have a lot of theories in behavior change in health that are really geared around the attitudinal knowledge, attitude, belief, intent, health stages of health behavior change all relate to this sort of attitudinal. And understanding your audience, this is essentially the motivational interviewing is doing, right? Trying to understand the audience and to where they're receptive for what concepts, enthusiastic, indifferent, or negative. And therefore you might tailor your message differently depending on where that person is relative to wanting to say, exercise more, eat better, get back to music. So what happens to do these market segmentation studies, and I'll go through an example, are usually large surveys. You can get at this qualitatively. You don't have the resources, and talk to your target market and different groups, and you can start mapping this out qualitatively. The large studies that are done in the private sector may include 1,000 to 3,000 people. And the idea is that you want to have enough samples so that your clusters are large enough. It's a cluster analysis such that you can look at, of this cluster that might be clustering around a certain attitude or a certain use occasion, etc. We have enough samples, 150 or so, that I can describe them. And then by understanding that cluster, you can start to strategize around A, what good are they, and B, what communication strategies or ways of pitching your idea to them. Okay? So I'm going to walk through an example on how you actually use them strategically. Or maybe I will. Why is this not going? Do you know why it's not forwarding? Answers it. Mouse is working. So the next slide that they're getting it up is I'm going to walk you through what might be what they call conceptual maps, which comes out of the segmentation study, where you're looking at axes of what might be variables that you survey, and then you start to look at where functions of people fall in particular timers.
Was she there?
Yeah.
So we move to the next one?
Yeah. All right. So I'm going to use one that's toothpaste because that's a consumer product we can all identify with, and it has some health benefits, right? And I'm going to then say, how does this relate to what might be more of an implementation area in which we're trying to get diabetes screening occurring in people with serious mental illness. Okay. So you start off with usually a 2x2. This is after you've done your analysis and you're trying to find out which factors seem to be driving the clustering. I won't go into those methods, but more or less the variables. So you might have one that is an axis that talks about the benefit you're seeking in terms of the medical benefit. So at the base level, for toothpaste, we say we want to fight cavities, right? And at the ultra level of benefit, we might say we want to fight cavities, we don't want tartar, and we don't want gingivitis. We don't want bleeding. Right? So that's one scale. The other scale might be benefits that relate to cosmetics. So one cosmetic is a flavor benefit. People who like to use mouthwash might really appeal to a very strong, flavorful toothpaste. On the other end, there might be people who really gravitate to the cosmetic benefit of whitening. Okay? And so you then say, given that, where might there be some clusters? People who come together and say, I agree, this set of parameters is important to me. So you might have a segment A that really associates with fighting cavities, not so much on flavor and whitening, it's okay, but that's not their main focus. Another group that wants to fight cavities, but they really want to come out with very like teeth compression or using white strips, right? Or another group that says, you know, I want it all. I want the complete toothpaste, total toothpaste that addresses all of these things. I want the most efficacious toothpaste you can find. And another group that might say, gee, I just using it to getting rid of cavities, preventing cavities, but I really want my glasses. Okay, so you might have these segments. And then you can imagine how products that are matched to those segments. Right? So if you think about it, if you've ever looked at the grocery store and all of the different versions of toothpaste, you can imagine then which toothpaste are going after which segment. So I'll use Crest as an example. They call it the Crest Red Box. That's the historical Crest flavor. These are people who just say, hey, toothpaste is toothpaste. Right? Then those that are looking for whitening, there's a product for them, 3D whitening. If you want more than that, you can get the Crest White Strips or any of those other products that are really about making your teeth look as white as you can with them professional. The ones with the ultra benefits, if you bought Pro Health, that's geared towards them. And D then would be Crest Fiscal. Right? And so you can see, therefore, how a consumer product company has created specific products to match those needs. And the reason why I think of this is if we had created a product that was trying to not be bad in any of these areas, but not necessarily delight on any of these axes, you end up with something probably in the middle. So no one is truly hating it, right? It's okay, but no one is truly loving it. And in the consumer world, what that does is it makes you vulnerable for competition, right? Because if I have something in the middle and someone comes out with tooth whitening, then the people who really are looking for tooth whitening are going to start buying it. Okay? So in an implementation strategy, if you don't think about segmenting and you just do something that you think might work for the general population, you might not really be finding the right solution that's optimizing for that group, right? So let's go, we'll go with the diabetes one next to illustrate. Okay, so this is a bit theoretical. This is the study that we just got funded is to replicate this approach, all right? So I'm making it up what we see, the hypothesis, right? We are working within the state of Missouri Medicaid. We are looking at patients who have serious mental illness that are being prescribed antipsychotics. And we are trying to figure out with this state what's the best strategy in order to improve diabetes screening rate. On average, maybe 30 to 50% of patients are getting screened each year, and it should be 100%. For those that may not know, patients with serious mental illness tend to die 20 years earlier than the general population, primarily due to excess cardiovascular disease, not just the mental health fluid that is the cardiovascular. So this is a big area. The state's really engaged with it. So where do we focus? So we might learn one parameter could be knowledge. Right? Well, let me back up. We think people with serious mental illness is just receiving care, let's say, in community mental health centers. Maybe just being prescribed antipsychotics by psychiatrists. When you actually look at the market, there's about 3,600 prescribers of antipsychotics in the state. Only about 200 of them are psychiatrists in a community mental health. And only about 700 are psychiatrists. So the vast majority of prescribers are actually not psychiatrists. Right? So you can imagine already there might be different needs and strategies to reach the primary care doctor who might So one could be knowledge, that this is either a risk that we should be doing anything special about. Could be low knowledge or high knowledge, right? Patient access to screening may be very different in those settings. Right? If you're going to a primary care setting, what do they routinely do? They look for diabetes, they look at anemia, etc. They are set up to be able to collect those kinds of labs easier than a psychiatrist, in which many solo psychiatrists, if you're going into that practice, they don't have the skill. They don't have, they're not going to be able to check the blood pressure. They're not looking at weight circumference. And then you probably have clinics somewhere in between. So if you do this segmentation, you might find, this is a group here that has high access, it might be primary care, but they may be relatively less knowledgeable about the cardiovascular risk outcome and why patients with serious medical illness need to be screened more often than ADA guidelines for the general population. A B segment might be ones that are psychiatrists. They've gotten a lot of risk information communicated to them within their medical literature. They understand that this is a risk to their patient. But they're not set up very well in terms of providing access to diabetes screening, other than referring you out to another study. So you can imagine if these are the segments, rather than the state doing one general program for the whole state, they might actually segment their interventions accordingly. So for some doctors, they might go with more of an education and start out there as first we've got to get them knowledgeable. This would be something to do. If I start coming in with strategies of how to build it into their electronic health records, that's a little bit too far downstream. They haven't even bought into the concept of this group and special screening. An intervention strategy that might make sense for psychiatrists, let's say those in the community mental health setting who bought into the concept but don't have the facilities to do it, could be a low-tech version, which is let's bring a screening fair in to help facilitate screening. Or it could be a more extensive high-tech engineer in, and this is what some states are doing, this is what Santos is encouraging, is the co-location of primary care with mental health services. So they're in one facility. The psychiatrist says you should get screened, you can go down the hallway and get your blood drawn. You're going to one location. Okay? So you can see then how a state, they would want to know what are the segments and also the relative size of them. So if I have limited dollars to invest in an implementation intervention, who should I focus on first? And this is where you've got to think about it in two different ways. One is, as I said, if you think about it from the standpoint of providers, right? There's more providers that are probably in segment A, but they're spread all over the place. There's fewer providers in segment B, let's say community mental health clinics, but they're aggregated. They're easier to reach. And then if you also consider, well, what's the number of patients that these providers are seeing on an individual basis, and you sort of look at the population attributable impact of reaching those providers, you might find those at the community mental health centers, they have high volume of patients. And so that may be a place to start first. And intuitively, I think that's what the states have done, because they have more direct control over community health centers, they more organizationally report more into the state. But this would help to guide us to say we're doing that for a reason, not just for convenience, but because we feel we can get more bang for the buck in improving health of patients. And therefore, given that, where should we focus our strategy? Should we try and do something that meets everything, or should we just say we're going to focus on something? Okay, so this is how we're hoping to use the segmentation study that we've been funded to do to provide guidance for the state and what it might serve them on. So now that you've identified the segment, the group of people that are the setting, the provider, the patient type that you want to focus on, next comes how might you think about positioning your implementation strategy as a product, a service that you're offering. Okay? So this is the generic positioning statement that's done for a product. To target this group, X is the brand of this is a category, right? Therapeutic category, product category, etc. That this primary benefit is possible because key attributes, reasons to believe. Right? So it's a little fuzzy, I bet. So let's take one as an example. Coming back to toothpaste. To moms of kids 3 to 12, That's my target. Right? Crest is the brand of category toothpaste. That, what's its benefit? It prevents cavities because of an FT fluoride. Right? So the challenge is, it sounds, how hard is this? Well, there's a lot of thought that went into, well, why moms with kids 3 to 12? Why did they choose that segment? Well, this is a segment that you have highly motivated mothers that want to look for the health of their children. Moms at the time, when this was initiated in the late 50s, early 60s, were the primary purchaser of toothpaste. They're the decision maker. And where they focused on cavities in early childhood caries, it's largely ages 3 to 11 for the general population. Right? So you're focusing on that. And you can see, therefore, how their tagline, "Look, Mom, no cavities," is very much focused on that segment. Right? "Look, Mom," is directed back to the mother, and no cavities. Right? And the reason to believe is that it has fluoride. Okay? So it's trying to, if you can distill down who are you really focusing on, it's an exercise that really forms you. So I tried to do it for my example. It's a little rocky. This is the art of refinement, but I'm using it to try and illustrate for you. So how might we think of it? We're not selling products, right, for intervention strategy. So we might say to target this group, still, X is the intervention or the implementation strategy, if you will, for frame of reference for doing this. The benefit of this is this and because, right? So to psychiatrists and community mental health centers, I identify that as my testing. Co-location, that's my intervention strategy, my brand, is the intervention for diabetes screening of adults with serious mental illness that reduces cardiovascular risk because patients see the CMHC as their medical home. Okay? And the point here is to choose these red spaces, it doesn't really show on red so much on the screen, but choose these elements that really resonate with target users. So it's one thing for me to create it. This is where what Karen was talking about is the iterative process with mixed methods and qualitative. You would go in with that target and start to talk about, well, what benefits are really important to you. Understanding that such that your positioning is really resonating with something that is important, not just what we think is important. So there's a lot of check and validation and a work process in of itself to get to a statement like this. But once you're there, then you know exactly what you're trying to deliver, to whom, for what benefits, and it really provides focus for the next step, which is, now how am I going to go about the implementation of it? How do I best sell it if you are a market? And that's where we'll go next. So why do we position, just to summarize, to better focus our strategy? And this is a quote from the CEO of Intel. Every idea and technical solution should be focused on meeting consumer needs. And it's very easy when we think of consumer needs and we think of health professionals to focus on the bottom left-hand corner, which is functional. So what are these functional needs to provide? On one hand, it could be, I'm going to reduce morbidity and mortality for my patient. I'm doing this, it's going to have those kinds of benefits. And so if you think about for a drug, it's the features of that drug provide certain benefits. It reduces cholesterol. If I have this surgery, it reduces the risk of reflux. Right? So it's the functional thing of what it's doing. And there's a lot of value in it. But, okay. There's the economic value, right? So a lot of, what's the economic value of what you're trying to do? Economic value is not just money, but it's time, it's effort, it's resources they have to purchase. So if you adopt this screening, you're actually going to save costs in the long run. That could be a way of positioning the benefits. Right? We're going to reduce the cost in the long run to society. And an emotional benefit then is bringing to the aspirational goals. Right? if I screen, I know I am a leader among my peers. It makes me a thought leader, and I know I'm cutting edge. It appeals to me on an emotional level. Right? And for some folks, that think of Starbucks coffee. It's coffee, but it's appealing to an emotional. Writing Toothpaste is appealing to the emotional piece of looking good. If you've ever looked at like television commercials and showing them with shampoo in their hair, fine, right? That's speaking to an emotional benefit, right? It's not just my hair is clean, but I feel it, right? So the question is, all right, we're in healthcare, where does quality fit in? And that's what you've got to think through, given your target audience. Which one of these points of the tribe might resonate most with them? You might be in a setting in which the incentive, if I adopt this electronic health record, I will not only save money in the future by better, more efficient billing processes, but I get money back now. So now I have an economic value to it. Even though it's providing me a functional benefit, I might resonate most with the economic value. Okay. So it's sort of thinking in your own particular case and the population that you're focused on, which one of these work. And just like with the targeting, if you try to have a product that's trying to do all of these things, then you're just diluting yourself. And it's best to really focus on particular access and key driving reasons for people to buy. So once you know that, then it's thinking through what's the right, as I can say, marketing mix. And if you've had a marketing intro class, I talk about 4 Ps. There's a newer concept that's been put forth called EVA, which is more, if we're in an environment that's more consumer-focused, service-oriented as opposed to tangible products, is how do we translate this product promotion price place into terms that relate more to service delivery. And I think there's more applicability to what we do in healthcare implementation, because in many ways we're providing service, either a healthcare delivery service or a service to help improve their health or prevent disease. Right? So traditionally, a product would be, what's my toothpaste I'm going to make? What should be the size? What should be the flavor? Etc. For a service, you might say, well, what's the solution I'm offering? I'm thinking solution, what's the problem that my target audience has in their practice, in their setting, and how can I think about my interventions in a way that helps solve their problem? So it's really getting in deep. That's where the qualitative research is really understanding that segment. What are their day-to-day problems? The promotion is what you might think of as advertising. What's your advertising mix? How are you going to communicate it? What's the commercial? Think of it that way. In today's world, what is the information? Not just on pushing it out, but how can I provide information such that my audience wants to come to me to learn more? How do I have a dialogue? How do I have a conversation? How do I get a social media as a tool in this context? Price. It's not just the price of my toothpaste is $1.99 a tube or whatever it is. What's the value I get out of adopting this particular? What's the value of getting patients to get vaccinated? What's the value to a non-number 2-year-old? How do I translate that into a value statement? Value being value of my time, value of my expenses to travel, to and from, to get care, value in lost work days. You're trying to think of the economic side of things. And then place relates to traditionally, where do I sell it? Right? So where do I distribute it? So am I distributing my toothpaste at a convenience store? Am I distributing my toothpaste at a department store? Or am I at a grocery store? Okay. So if I'm in a convenience store, I might have small tubes of toothpaste because people are traveling, coming and going, like at an airport, right? That's where they have small plastic. So given that place, I'm going to tailor my product, right? If I'm at a department store, I'm not going to sell price there, but some department stores would sell very high-end whitening products because that relates to cosmetic lines, people want to feel beautiful, and so there were some that were experimenting with that. And then we also know this. So what does access mean to us? And that's nice for a product. Well, access might mean how do I get this information on what we do. So access is it built into the electronic health record? That's the key. That's the place where I get information to know to do this behavior. Is it on a mobile app? The place is actually wherever I am trying to make a decision. If I'm trying to help with healthy eating, you know, there are some people experimenting using on the phone, the GPS system such that when you're actually in certain settings, it knows it and it pushes out a message. Right? So you're trying to, as best as possible, get what your intervention at the point of decision making as close as you can. Okay, so I'll just go through each one of these a little bit with I must get stuck. I just must get stuck. Right. All right. So while they're unsticking it, let me go to the next slide, which is looking at product solutions. So when you're talking about the context of more social marketing, there's the physical product that you might have, which is the actual product, the good or service, right? But then there's the core product, which relates to the benefits of what you're doing, the style benefits or the health benefits. And then there's what they call augmented product, which might be the additional elements that you need to have in place in order to support the behavior. And so, okay. So I'm going to use the example of diabetes screening just to illustrate. All right. So the core product might be what I'm really trying to do is promote cardiovascular risk reduction. If I'm talking to a psychiatrist, it might be important to them. This is a functional benefit of screening, right? We get people who have diabetes undiagnosed being treated. The actual product might be the intervention is co-location. That's my strategy for bringing them together to facilitate screening. The augmented product would be, well, if I'm trying to co-locate, I obviously now have to think about the physical facilities. That's a resource I'm going to have to consider, and then also billing. So, FQHCs and community mental health centers, there's directed segmentation or fracturing of that, and how do you allow billing for primary care services to occur with different regulations that I have to consider. Okay, so that's how I might think about co-location and the product is a broad sense. Promotion or information is dissemination, right? Messages, who are your messengers, what's your creative strategy and story or hook, and what are your communication channels. I'm not going to go into all the details here other than to say many of us are not trained in this. Right? If you're coming out of a health background, we are not the creative, right? So if you think about someone creating a commercial, like I am delighted when you see like the new iPad or any of the Apple commercials. They are just visual, creative, on target. Right? I can't do that. So the point is that you know that you need to be doing this, and you want to try and find professionals that you can surround yourself with to help you do that. And there are resources here on campus that many of you may not be familiar with. Travis Community, I think he's working with you, Dan. So this is there's a department of scientific media design, downtown campus, in the College of Arts and Media. We're working with someone that's in the media production side to put together some content for our Chris website. Right? These are people who are trained on how do you create a story, how do you think of the visual elements, right? And we work with them just like we work with ad agencies. Epic CSU. So CSU is a partner with the School of Public Health, which is talking about it. They have a technical communication and journalism program, and there are experts there on thinking about how do you communication theory, and they actually have one on how do you course on how do you communication to health professionals. So there's opportunities to network here locally, and I think the main message is to recognize we all help one another. How do we think about price and value in the context of social marketing or the kind of marketing we're talking about? Is how do I increase the perceived value? And you can do that by increasing the value of the benefits of the desired behavior, decreasing the cost of the desired behavior, and increasing the cost of the competing behavior. So let's just walk through that quickly. So benefits of desired behavior. I think there's a lot of work right now around adoption of electronic health records. That's my implementation strategy. I'm trying to do that because we believe it will lead to better quality down the road, or better savings or efficiency. So how do I increase the benefits of that, dollar benefits of it? I go out and incentivize practices that if you adopt it within a certain time period, you're going to get X thousands of dollars from the government. So now the perceived dollar value of it becomes higher. The non-dollar value. If I am getting, I need to get accreditation or some sort of notice of quality improvement that I'm doing in my practice, right? As a quality measure, I'm adopting electronic health records to meet that need. It's meeting the need of what might be non-denominational concepts. The cost of the desired behavior, I'm trying to reduce costs. I might facilitate rebates is also a way to do it, or try to facilitate group purchasing rates for electronic health records in order to reduce costs. And then the competing behavior would be the non-adoption rate structure, right? So one way to think of increasing costs of that that's maybe non-dollars is you start telling people, here's the number of doctors in your community that have all adopted, right? Soon, as you start to get that tipping point and more people have adopted, you are now the outlier with your peers, right? So that has, you're now increasing the psychological cost, perhaps, of not adopting because everyone else is, right? So thinking about your own area of what you're trying to implement, how might you incentivize financially? How might you incentivize not financially? We don't always have budgets to do that, but it's to think about that, or partnering with the system that you work with that can have some of these involved. And lastly, place and access. So for implementation intervention, you can consider how do I improve my convenience, access, reduce psychological barriers, like stigma and location, and really try to provide my intervention at the point in time of decision making. All right. So, you know, the one with the community mental health center co-located with primary care. That's one way of trying to make it more convenient for patients for receiving care of those centers to get their blood drawn, as opposed to having to go to another site and check for all of it. Psychological barriers could be things that we might do. Sometimes in what we do, we're dealing with, if you're seen at a certain kind of care delivery site, it might cause some stigma, right? I don't want to be at a mental health center or at maybe this HIV treatment center, et cetera. So how can we think about creating it in a way physically that it is a good environment? That's kind of at a health care side. Okay. I don't know what's going on. I'm just so excited. All right. So the last slide I wanted to really is tips from social marketing. And so if you step back and look at the textbook that's written, there's several tips that I'm just going to go through quickly, and they're on the slides, and they're just good reference points to keep in mind. Yeah. So it's taking advantage. Okay. It's taking advantage of existing successful campaigns, which is what we do when we research and we apply. We look for toolkits that work in other settings, and we look to adapt them into other settings. It's starting with target audiences that might be most ready for action, more receptive to what you're trying to do, right? So that's pilot demonstration projects, right? Thinking about that as a strategy. Being very focused on what is the single doable behavior that you want people to do. Oftentimes when you're trying to implement something around healthcare delivery or improvement, it's sort of multifaceted. Can you really distill down to one thing you want someone to do next? You know, this is what's done in motivation. What's the one thing that they can walk away with? So let's say diabetes management for people with serious mental illness. There's a lot that goes into it. Reducing cardiovascular risk is more than just treatment. It's compliance. It's a lot of things. But if we can just focus on starting with screening first, let's start there, and that's what we're going to do. Okay? The other is to think about the barriers to those behavior changes. Make sure that we really understand what the barriers are for their audience. Okay? And then how do I bring the benefits of diabetes screening to the relevancy of psychiatry for the community? It's trained to treat mental illness who's not rewarded for the management of diabetes. How do I make this relevant to them? How do I make it appealing? Maybe it's at a higher level at a professional level. You know, our job as doctors is to look at the patient, older patient. We have to be thinking about the total body, not just the mind. You know, that kind of thing. And then figuring out the media channels at the point of decision making that makes sense. A lot of what we do is brochures or pamphlets or something. How can we be more creative with mobile apps, for example, mobile technology, if they're relevant? And how can we use these for visual or auditory products? Engineering anything, right? So when you think of yourself driving a car, it beeps when you don't put on your seatbelt, right? So some electronic health records, systems will have it that you or flag for you or something. So that's one way. And we're not talking about it here, but really tracking the results. And other talks will talk about evaluation and the importance of evaluation such that you can make adjustments. So the difference between, I think you go to the next slide, a campaign is that it's a continual process. When we run studies as research, we run it to the continuous, to the end, and then we evaluate. Campaigns are much more of real-time learning, maybe a little sloppy from the research side, but it's this kind of continual learning process. More like quality improvement. And I hope that you took away that marketing is one lens that we might be able to use to frame implementation science. It gives us a systematic approach. It allows us to be strategic on where we focus our energies. It's coming from the point of the consumer, whether that be the provider, the patient, or the health care setting, such as the hospital, and what's really of value to them. And how do I position my implementation strategy in a way that's valuable to them? And then thinking about measuring that and measuring. So I'll just leave with this last slide, which are some further resources if you are interested in this. I have the textbooks up here if you want to glance through it. So the classic one is social marketing is now in its 4th edition. It's very applied for social marketing, and since a lot of that deals with health, there's a lot of health. It's really relatable to health, I think. If you're interested in the article around not just thinking of the 4 Ps, but a consumer-centric virus is the article that comes from. And then I also have a book, if you really, marketing then drives these strategies into plans, which are really how you operationalize the execution of your marketing plan. And there's the whole way of organizing that thinking, so that's also systematic. This book is very good in giving a framework on that. It's in marketing lingo, so you have to be like translating in another language while you're reading it, but it provides excellent framework for those that are thinking about this as a way to frame a quality improvement initiative. And if you're really excited and you want to get more continuing education, I attended a few of these this last fall, and I thought they were excellent. Kellogg School of Management has executive education, and there was one I attended on strategic communication for the digital world, and another one on consumer insight and data-driven marketing that are really very applicable to methods that I was talking about here. It's how do marketers think about evaluation and the strategy for communication, and how we look for bridge to what we're doing. So that's all. If there's any questions in the last 5 minutes or so? Thank you. Any questions? Thoughts? Comments?
Comments based on the really